Candy Patton, and today I will be performing a head-to-toe assessment. So first I would walk in, I would perform hand hygiene, close the curtain to ensure patient privacy, and I would introduce myself to the patient. So good morning, my name is Candy and I will be your nurse today. Can I ask you a few questions?
You can.
Okay, so I would look at his wristband and ask him if he can please state his name and date of birth.
Grant Patton, 5/18/94.
Okay, perfect. And do you know where you are right now?
I'm at the hospital.
Okay, and do you know who the president is?
Donald Trump,
Right, and what year is it?
2020.
Okay, great. So I ask these questions to make sure my patient is alert and oriented times 4, which he is. And then I'm going to be performing a head-to-toe assessment on you. Is this okay?
It is.
Okay. So I'll start with his head, and I can palpate, make sure there's no masses, and he seems to be normocephalic. And then I would look at his ears. Okay, great. Make sure they are symmetrical on both sides. I'm going to inspect your eyes. Just look straight, and I'll shine this in your eyes real quick, okay? Okay, perfect. If you can follow my pen line. Okay, follow it inward. Perfect. So as I'm doing this, I'm checking to make sure his pupils are equal, round, reactive to light, and make sure they accommodate. If you can look up, I will assess your nostrils. Okay? And if you can open your mouth for me, say ah. Okay, stick your tongue side to side. Okay, great. So his mouth seems to be pink and moist. There's no signs of infections. I'm also looking at the tonsils, making sure they are midline. If you can shrug your shoulders for me, great. Okay, squeeze my hands, pull me in, push me away. Okay, great. Now just lift your arm straight up for me. Okay, great. You can put him down. So I'm checking to make sure his upper extremity strength is equal on both sides. And if I had the tool or a reflex hammer, I would assess his reflexes right now. So first I could do here, and I'll tap. It's supposed to go like this. You can go to the side. I'm going to do the tricep. Tap here, and it would go outward. Great. Go down and assess his patella reflex. You would hit here, and you would want it to go outward. You would hit here and want it to go outward. I could assess his Achilles, assess for Babinski. Great. I performed hand hygiene since I was at his feet. Okay, and then at his hands, I would go ahead and assess a heart rate. I'm going to do this for 30 seconds and multiply by 2, although you can do for the full minute. Okay, so I assessed his heart rate, which is 90, and this is within normal limits, which is 60 to 100. I would assess capillary refill by looking at the nail beds and making sure those are normal. No signs of jaundice, making sure this capillary refill is less than 3 seconds. I'm assessing his skin as I'm doing this, making sure there's no lesions, no signs of jaundice, and making sure that the skin is intact. Next, I'm going to go down to his feet. Okay, so I'm going to check for capillary refill in his feet, making sure it is also less than 3 seconds. I'm going to be checking for the pulses in his feet. Okay, the insides. Okay, great. And you're wanting these pulses to be +2 and easily palpated in both feet to make sure there is signs of perfusion to his feet. And then I would also assess for signs of edema or fluid restriction in his legs. Okay, is there any pain as I'm doing this? Okay, great. Can you pull your knee up for me? Great, straighten it out. You pull this one up. Okay, so he has full range of motion. Now if you can push against me like a gas pedal, pull upward. Okay, great. So as I'm doing this, I'm assessing his strength in both legs, making sure there's no right-sided or left-sided weakness of any sort. Okay, so I can perform hand hygiene, and now I'm going to listen to his heart. Okay, and I'm going to be going under his shirt while ensuring privacy. You can just breathe normally right now. Okay, and now I'm going to be assessing his lungs, anterior and posterior, and I'm going to be listening to the upper and lower lobes. So you want to do this in a ladder formation to compare both sides and make sure there's no adventitious lung sounds. Can you take a deep breath for me? Okay. Okay. One more time in the front. Okay, now if If you can sit up for me, I'm going to listen to your lung sounds posteriorly. Okay, great. So there are no adventitious lung sounds. You want to hear that clear air movement as he inhales and during exhalation as well. Okay, so at this point I could also assess his respirations. I would assess his temperature and blood pressure if I had the tools to do so. And at this point I'm going to go ahead and get you to lay down flat so I can assess your abdomen. Okay, I'm going to pull your shirt up a little bit. Okay, and as you're doing this, you do want to listen in all 4 quadrants. Okay, so I listened in all 4 quadrants, and you want to make sure you do hear those vowel sounds present. If you feel like you do not hear any vowel sounds present, just be sure to listen for the full 5 minutes. And in all quadrants, I'm just going to palpate. Just let me know if there's any signs of tenderness or pain. No pain?
No pain.
Okay, great. You can sit back up for me. So I'm inspecting the abdomen as I'm doing that, and it is non-tender. You're wanting to make sure there's no signs of rigidity as well. Can you tell me when your last bowel movement was?
Yesterday.
Okay, and was it formed? Was it firm? Any?
Yes.
Okay, and when the last time you urinated, was there any unusual odors or smells, or did it look different? Okay, so that's just assessing his last bowel movement and assessing his urinary patterns. Okay, and so make sure as you're doing the full head to toe assessment, you want to assess his skin. You want to assess, make sure there's no signs of abnormalities, and to make sure the patient isn't in any pain. I would also rate his pain, get him to rate his pain on a scale of 0 to 10. And if there is a sign of pain, if he's having right lower quadrant pain, just be sure to do that area last. And this concludes my head to toe assessment.